All right, this is Emily Peters recording Unit 5, Newborn Feeding or Nutrition. All right, so just some quick overview with nutritional needs of the newborn. Breastfed babies, as you can see from the slide, get approximately 90 to 100 kcals per kilogram daily. Formula is pretty much close to the same, slightly higher. Basically, all the nutritional needs our infants need comes from breastfeeding or formula. The fluid intake is right in that same amount, 80 to 100 milliliters per kilogram for 24 hours. During that first week of life, kids will lose about 10% of their birth weight to be expected, so we don't really worry that much about it. The carbohydrates, proteins, fats, minerals, all of that is adequate in breast milk or formula, and they don't need any supplements typically. Some kids may need some vitamin D supplements due to rickets, but pretty much in the United States, we don't typically have to deal with that. When it comes to iron, the iron in the formula and hopefully in mom's diet through breastfeeding should be adequate enough that they don't need supplemental iron until they're around 6 months of age. Water is not necessary for newborns. The only water we would use would be to mix powdered formula to make it liquid. If we feed babies water, that actually just fills up their stomach and decreases their caloric intake, and therefore does not make them hungry and actually can cause nutritional deficiencies in them. Okay, breast milk is made up of a bunch of different things. You have 4 different types of, or actually 3 different types of lactogenesis. You also have the transitional milk. Colostrum is that first milk that we get. It's very high in immunoglobulins, very high in proteins, which actually helps with bilirubin binding. It's also a laxative, which helps with the secretion of that MEC stool. The colostrum is that very first milk that kind of comes up, or the first discharge from the breast before milk actually truly comes in. Breast milk usually comes in around day 3 to 5 for most kids. Mature milk is the end of lactogenesis, and that is as we are really getting that mature milk, and breastfeeding is really kind of established. All right. There's lots of pros and cons to breastfeeding and formula feeding. I'm just going to go through some of the pros. Hopefully we'll have time in class to go over a bunch of the other ones. Some different things with breastfeeding. It promotes intestinal flora growth. It protects the intestines from pathogens. The leukocytes that are in the breast milk help protect the child from infections and protect them with their immunity factors, since those kids do not have immunity built up, and therefore what they have in their system comes from mom. Breast milk with moms. The fatty content in mom's diet, it depends on how fat the milk is going to be. The proteins, carbs, and minerals mom eats will affect the baby. So if mom has a poor nutritional diet, then that milk that she's feeding her child is going to be poor nutritionally. So moms need to make sure they're doing a very good, balanced diet for it to be beneficial to those children. Newborn nutrition. Human milk is definitely easier for babies to digest compared to cow's milk. Both are very safe. Breast milk definitely digests easier and expels easier from the system, whereas formula is a little bit harder to break down, and therefore they don't have as many stools with formula. If there is something in the child's nutritional background that is affecting their diet, so let's say they have allergies, things like that, and we are able to attribute it to being passed through the breast milk, we can alter their diets and either alter the mom's diets and have her not eat those things, so therefore it won't pass through the breast milk, or we can go ahead and put them on specialized formulas. We can also make the formulas higher content for calories if needed for kids that are struggling to gain weight for whatever medical reason might be going on. But we can also add formula to breast milk to make it higher calorie. Formulas basically are modified cow's milk. It has a little bit reduced protein. It has all the other nutrients that are needed in it. It is just as safe for kids as breast milk. The only thing we can't supplement in formula is all the amino factors that we can get through breast milk. But we can also do other things to formulas depending on what the situation for the baby is needed, which can be a lot harder with breast milk. Bottle feeding. Bottle feeding is pretty simple, but we can cause some issues with bonding with bottle feeding, because what do we end up doing? A lot of parents end up thinking, oh, if this frees up my hands, I can prop the bottle, I can do this, I can do that, and therefore that can cause more problems for the baby. It can also prove that there's some bonding issues. So those are some things to think about. So we need to make sure if we are bottle feeding these babies that we're holding them and we're interacting with them. That interaction has proven to help with the child's maturation and their growth as well. We need to teach the families, if they are going to teach formula or if they are going to feed formula, that they're preparing it correctly and following the directions on the containers. Formula can be very expensive, so to save money, parents will often maybe not mix it completely to the ratio that is needed, and they can cause severe nutritional deficiencies in their children. Bottle feeding kids tend to eat less often, so they tend to eat every 3 to 4 hours, whereas breastfed babies tend to feed every 2 to 3 hours. Our goal for all kids with especially newborns that are eating is to have them all eat, whether it's breastfeeding or bottle feeding, approximately every 3 hours, so somewhere between 8 to 10 times a day. We also don't want to force feed the children either, and that sometimes happens with formula feeding. It is so expensive that we don't want to waste any of it, so parents sometimes force feed their children to finish off the last drops, and that's why we sometimes have that obesity issue. So our role as nurses is to know the pros and cons of breastfeeding versus bottle feeding, supporting the parents whatever choice they make, and giving them as much help as possible and making sure they're understanding what is going on. Advantages of breastfeeding. For the baby, breastfeeding helps mature the GI tract. It provides antibodies and cell-mediated immuno factors. Breastfeeding is supposed to decrease the risk of SIDS, ear infections, and allergies in those kids. It's supposed to help protect against diabetes and obesity, and it's supposed to increase cognitive development in kids. Maternal benefits, it decreases the mom's risk of ovarian, uterine, and breast cancer. It also promotes the involution of the uterus back to its original spot pre-pregnancy. It helps moms get back to the pre-pregnancy weight faster, and of course it has better bonding, and it has less cost since breast milk is essentially free. Disadvantages of breastfeeding. Mom's the only one that's going to do it. So she needs to be aware of the personal choice of it and the fact that she's going to be the one feeding that child 24 hours a day, 7 days a week for however many months to years they are doing it. Mom's going to lose a lot of sleep. There's a lot of separation things. The moms have to be careful what meds they are on and things like that. All right. Advantages of formula. It can be taken with you easier. You can keep powdered formula in a bag and water close by. You can mix it up and you don't have to worry about people seeing you feed your child, exposing yourself and things like that. Everybody who's around the baby can help with feedings. The baby sleep longer time in between feeds type of thing. You don't have to worry about knowing how much the child is getting because you know how much they're getting through the formula. Disadvantages, there's tons. The cost is the biggest one, I would say, for formula feeding, and there's a little bit more equipment typically. Honestly, you don't need to supplement after breastfeeding unless there's an issue with the child too, with growing. I think it really needs to be up to the parent's preference. Technically, yes, breastfeeding is better and safer and healthier for the child, but if mom chooses not to breastfeed, we need to support them as well. I kind of went through all this, right? Support from others, especially if you're breastfeeding. Mom's going to need a lot of support from her husband and their family members. There are cultural reasons why some people don't breastfeed. Employment, if you're breastfeeding and you go back to work, that can make it a challenge. So you may have to consider pumping. And then you have to find a safe place to pump multiple times throughout the day. And you may not be able to do as much as you need to keep up that supply and demand. So that can be an issue. Normal breastfeeding. The breasts are going to get enlarged. They can be hard at times. They shouldn't be uncomfortable. To continue with the milk production, it is that supply and demand type of thing. So you want to make sure that that baby is gained a breast every 3 hours at least around the clock to keep the milk supplement and the milk built up going on. We do sometimes recommend for the moms to make sure they're pumping in between breastfeedings as well to increase that supply and demand, especially if that baby isn't feeding off of both breasts at every breastfeeding. Babies should feed a good amount of feeding. So they should eat consistently for around 20 minutes to a half an hour per feeding. That usually is a good indicator that they're getting enough. But we also need to look at, are they settling after their feedings, or are they still acting hungry? Are they having adequate wet diapers? Kids that are eating enough should have a wet diaper with every breastfeeding attempt or bottle feeding. So up to 10 wet diapers a day. Of course, that goes up as they grow. At first, it's going to be less than that. I've mentioned this before. Human milk is the preferred, of course. The incidence of breastfeeding in the United States is going up because we're getting better support. Baby-friendly hospital initiatives, this is what their goal is. They do not encourage formula feeding, but they are pushing the breastfeeding. They also need to make sure when they're doing these things that they're educating the parents on recognizing if their child is getting enough. There have been some cases in some of these hospitals that education was not that great, and the babies have become severely malnourished. Those are rare cases, but if we are encouraging those moms to breastfeed and bottle feed, we need to teach them the signs of dehydration. Kids should sleep well after feedings, but they should also be vigorous in moving between feedings, sleeping for a few hours in between feedings. They should be, like I said, breastfeeding for an average of 20 minutes, about 10 minutes per breast, give or take a little bit of time. And that's active sucking. It could take 30 minutes to an hour to breastfeed a kid, but they've only actually actively sucked for 20 of them. Making sure that we're hearing the swallowing and we're seeing that milk discharge are also good signs that the child is eating enough. Getting that kid breastfeeding as soon as possible. So once those AFGARs are done, and if that baby's ready to bottle feed or breastfeed and eat, go for it, okay? They're going to be staying warm soon after feeding or staying warm by having that skin-to-skin contact. So that's going to help with thermoregulation as well. So as long as they're thermoregulated and their AFGARs are stable and they're breathing well, they can breastfeed within half an hour, sometimes sooner than that after birth. We do like to do on demand, but once again, that thing to think about is babies shouldn't be going more than 3 to 4 hours between feedings. We also need to be aware of mom's meds as well. Specific foods for newborns. Newborns don't need any specific foods until they're around 4 months of age, and that's when we can begin some early supplementation of introducing foods to them. Their GI tract isn't ready to be introduced to anything besides formula or breast milk until they're getting closer to that 4 to 6 months of age. So that's all we really need to think about, is that human milk has everything those babies need. And I've kind of gone through all of these benefits. Keys to successful breastfeeding is that position. So that's where we as nurses need to come in and just help assist with those moms and dads. First time breastfeeders, it can be a challenge. Each baby is completely different as well. So they could have a really successful breastfeeding attempt and breastfeeding experience with their first child, but their second child might be completely different. So that's something to kind of be aware of. I do jump in there and I'm total hands-on when I'm helping my moms learn to breastfeed. I do ask their permission first, but I will say, hey, I'm going to touch you. Is that okay? And then I go in and I help them. Dads, this is where I encourage dads to come in and help their wives or their girlfriends with breastfeeding, as I show them ways that they could assist. At first, it's going to be a lot of hands-on. Mom needs to learn, baby needs to learn. So that concept of bonding, this picture shows a lot of that. That baby sucking helps release all the hormones to help with the breast milk production, but it also helps with oxytocin, it helps with prolactin, all of that kind of stuff. But another thing to think about, the amount of inches from the mom's face to her breast is about as far as that baby's eyesight is clear at first, so that also helps with the bonding as well. Nipple type does make a big difference on the success of breastfeeding. Most women should have an inverted nipple like the top one. That makes it very easy for the child to latch on, because when they latch on to that areola and have most, if not all of it, into their mouth, that nipple should rub the roof of the mouth, which helps stimulate the suck-swallow reflex. If it is a flat nipple or an inverted nipple, that baby, when they latch on, that nipple isn't fully erected and it doesn't allow for that good latch or for that stimulation. We can do some things to help with that. We can stimulate the mom's breast manually. We can do a pump to help with that. We also have nipple shields that you put over the breast that then gives that baby something to latch on to. We've kind of talked through all of these things. The assessment, know what mom's going through, dad's going through, looking at those nipples to figure out what's going on, and then hopefully this baby will grow. We don't need to focus a lot on the assessment, nursing diagnosis, expected outcomes, but just kind of be aware of that there are some additional things we might have to do if you do go into labor and delivery or pediatric nursing. Once again, we kind of went through some of these things to look at. The latch of that baby's mouth is really important, making sure it's got the fish lips, making sure that most, if not all, of the areola is pulled into the mouth while the baby's sucking. You shouldn't be hearing a clicking sound. To remove the baby from the breast, you will break the latch by sticking your finger between the on the edge of the baby's mouth and breaking that seal. Otherwise, you can cause damage and discomfort to the mom. So this is a mom doing tandem football hold. I love football hold. As moms get good at breastfeeding and they have multiples, they can feed both babies at once, which is amazing. So this is a great picture to show that good latch that I was just explaining earlier. So most, if not all, of that areola and the full nipple is in the baby's mouth. The baby's mouth is open and wide. And as he or she is sucking on that nipple, it is being pulled into the mouth and rubbing the upper part of their, stimulating the roof of their mouth to help continue with that suck swallow. This mom is doing cradle. Cradle hold is a decent hold. It doesn't allow mom to have tons of control of the baby because with cradle, the baby's head is in that crook of the elbow. But she does have an arm free to adjust and hold her breast, which is very important. The one thing to think about is she's doing the C method with her hand. She wants to make sure she's holding back further on her breast like this mom is, instead of close to the areolas. Because if she's close to the areola, that's going to compress that and not allow that baby to have a good latch. But the cradle hold is a decent one for things. I prefer the cross cradle or football. This is football hold. One reason I like this hold is because that mom's body is kind of holding into that baby and controlling its arms and legs, but then her hand can control the baby's head as it moves around. So she can kind of hold it steady and guide it towards her breast, and her other hand is then free to hold on to her breast and to also move that as that baby is learning to latch on. One thing to think about when you're learning to latch on a child to the breast is to have the nose and the nipple line up so that when that baby has a nice wide open mouth, that if that nipple was where the nose was when the mouth was closed, then that means that when the mouth is open, that nipple should be lined up appropriately to hit the roof of that mouth. So by having her hand on the baby's head with the football and the cross cradle, she can manipulate how that baby's head is turned and still adjust her breast. Let's see. This is the cross cradle. And as you can see, mom's still able to kind of have that baby lay nice and comfortable, but she's able to control his or her head while also adjusting her breast to get into a comfortable position. This is side lying. kind of in a cross cradle or a cradle position as well, while side lying. Moms that are really good at breastfeeding can do a great job with this because they are really good at the technique of breastfeeding and controlling everything. This is very comfortable for the moms. One thing to be remembering is we shouldn't be sleeping with our babies in our beds. So as soon as that baby is done breastfeeding, he or she should be in a crib or cradle right next to the bed, but not sleeping sound asleep next to mom or dad. Here's another picture of that correct latch. So that baby's mouth is open wide, kind of like a fish mouth. The most of the areola and the full nipple is in that baby's mouth. Now, if mom has a small areola, the whole areola may be in the mouth, and in fact, actually some of that breast tissue may then also be in there. But for the most, if not all, of the areola. Another thing to think about is you can rub the nipple along the side of the cheek of the mouth, that edge or the crease of the lips, to stimulate the baby for the rooting reflex. Let's see else. Here's another picture of that's the correct latch. If those lips are flared out like a fish mouth, that should allow for those good movements and stimulation of the breast. If their mouth is not latched correctly, that's going to cause a lot of poor feeding for the baby. So he or she is not going to eat as much, but it's also going to cause a lot of discomfort for mom. Babies that are overly sleepy will not eat well. So I try to stimulate and wake them up. I will get them down to nothing for their clothes, so just a diaper on. I will put a cold washcloth on their head to wake them up more, to see if that helps. Kids with high bilirubin levels tend to be sleepier, and therefore they eat not as well. And we need to feed those kids because that's going to help rid their bodies of the bilirubin. Nipple confusion. This is a very controversial topic out there. We are starting to prove there is not a true nipple confusion. But one thing to think about is the difference with the suck swallow with a breast versus a bottle is completely different. So when a baby is closing his or her mouth around the nipple of a woman, that is what is causing the milk to flow and pull into its mouth. Now on a bottle, when the baby closes its mouth, that stops the flow. So it works the opposite in that terms, but babies that have learned to breastfeed well and have that established can flip between a bottle and breastfeeding easily. Jaundice can make them sleepier. Prematurity, they don't have a suck-swallow reflex until they're about 34 to 35 weeks. So they may not be able to start breastfeeding until that point. Illness and congenital defects can cause problems as well. All right, couple more slides, and we're almost done. Breast surgery, depending on how it's done, can affect the milk supply. Mom's job, the demand of it will not allow her to pump as much as it's needed, so that can cause problems with breastfeeding. Storing of milk. Fresh breast milk is good for about 5 to 7 days in the refrigerator. In a freezer, it's good for like 3 to 4 months, and a deep freezer 6 to 9 months for storage. Once milk is thawed, it's only good for 24 hours. Let's see. How can we help a mom who's with breastfeeding who has engorged breasts? The answer to this should be heat will help with the feedings, but massaging tends to help even more. And that should be our PowerPoint.